Stress and disease. What is it? Is it the fact that you're a full-time student and you work full-time outside the house and you have children that you are responsible for? Is it the fact that you're a part-time student working full-time outside the house and have children you're responsible for? Or is it the fact that you have parents that live in the area that require care? Or parents that live further than 75 miles away that require care? Or parents that are over the age of 65? Is it your significant other? Is it just the fact that you have kids under the age of 12? Or kids that are teenagers? Is it the fact that you live more than 50 miles away from clinical? The fact that you're on 3 other committees at church and school and whatever? Do you exercise every day? Or the fact that you can't exercise every day? That your support system is overseas in Iraq or Afghanistan? Or are you independently wealthy? What is stress? Stress is a condition in which demand exceeds a person's ability to cope. Any condition in which demand exceeds the ability to cope. Stress can also be a state of tension that can lead to disharmony or threaten homeostasis. Now, homeostasis is considered a dynamic, steady state. It's the norm. Your overall body composition does not change, but the components may vary. Stress is anything that promotes change. And when those components that are in our body remain changed over time, in the absence of a known stressor, you now have disease that's diagnosed. And an example of that would be hypertension. Because when you're under stress, your blood pressure goes up. And when the stressor is relieved, if your pressure stays up, you now have hypertension. And we'll talk about that a little bit more fully later on. Stress was examined in great detail by Hans Selye back in 1946. He developed a scientific model that was called the General Adaptation Syndrome. It was so named as any stressor was found to produce the same syndrome of responses. It didn't make any difference whether it was physiological or psychological in makeup. It's any stimulus that causes change. There are 3 components to the General Adaptation Syndrome. You have your alarm stage, which is your fight or flight, where you're ready to either attack the problem or run away from it. You've got your resistance stage, or your adaptation, where you either cope with the problem or you, again, cave in to it and resist it somehow. Or the exhaustion phase, which is the final phase that you really don't want to go through. And you're not required to go through all 3 of those stages if you do adapt. Now, the alarm stage is when the hypothalamus activates the General Adaptation Syndrome in response to a stressor. And that stressor causes the release of CRF, which is corticotrophin releasing factor. You do need to know what those initials stand for, because that will help you identify where they come from. Corticotrophin releasing factor is from the hypothalamus. It triggers the release of ACTH, which is from it's the adrenal corticotrophic hormone. In other words, it's from the anterior pituitary, and it goes to the adrenal cortex, causing the release of cortisol. ADH is your antidiuretic hormone, and that's from the posterior pituitary, because let's face it, if you're under a huge amount of stress, is that the time you want to sit down and go to the potty? Probably not. The sympathetic nervous system is activated to release catecholamines in this alarm stage. Now, there is a diagram on page 210 in Huther that diagrams this stage. But when you're doing this, remember what the autonomic nervous system is responsible for. You've got your sympathetic system, which is responsible for the fight or the flight. Sympathetic stress, it's activated anytime you're under stress. Parasympathetic response is your rest and digest. Parasympathetic starts with P. It's very peaceful. It slows things down. Everything starts to relax. This is another diagram from a different textbook. This one's not in our textbook, but a similar one is there, where it shows that you have stress that leads to the hypothalamus activating the sympathetic nervous system. And then you have, that leads to norepinephrine release from the sympathetic neurons to the heart, which causes an increase in heart rate and contractility, which leads to an increase in blood pressure. You've got the norepinephrine in the lungs, causing the bronchioles to dilate, which is, norepinephrine is a beta-adrenergic drug. You've got your norepinephrine in your blood vessels, causing your blood vessels in your skin, your kidneys, and GI tract to constrict. So that causes pallor and coolness to your fingers and toes. It causes less blood going to the kidneys, and so you end up with anuria or no urine, or oliguria, which is a decrease in urination. Again, you don't really want to sit down and go to the bathroom when you're under a lot of stress. The resistance or adaptation stage is when the body becomes adapted to the previous stress and then returns to homeostasis, goes back the way it's supposed to. It requires the actions of cortisol, epinephrine, norepinephrine, and aldosterone. Now, cortisol is released from the adrenal cortex in response to ACTH from the anterior pituitary. And cortisol does a lot of work, and we'll talk about that in a few minutes. Epinephrine and norepinephrine are secreted also from the adrenal medulla, but also from the sympathetic nervous system, which will come in important when we talk about endocrine disorders like pheochromocytoma, which is a tumor of the adrenal medulla. And you have to remove that tumor, you remove that adrenal gland, you still have your catecholamines being released from the sympathetic nervous system, so you don't have a deficit there. Aldosterone saves sodium in water by increasing blood volume and pressure, because the sodium saves water, so aldosterone saves sodium and water, and then that results in an increase in blood volume and blood pressure. Endorphins are also released during this phase, and endorphins make you feel better. And you can become habituated to the repeated stressors so that the stress response is lessened. In other words, if every time you plugged in an electrical cord you got a little shock, but it was the only plug you had and the only electrical cord you had, and you had to plug it in order to get heat, light, food, whatever, over time you wouldn't notice the little electrical shock you got when you plugged in that plug, because your body gets used to it and does not respond to that stress response. Now the third phase or final phase is exhaustion, and this occurs if the body does not adapt to the stressor. In this stage, the body is unable to respond is unable to return to homeostasis. It will result in death if adaptation is not achieved, and the death will occur because of impairment of your immune response, heart failure, and kidney failure. Now stress, when you look at it, consider it as a problem of psychoneuroimmunology. The study, that's the ology part, of the interaction of the consciousness, psycho, the brain, neuro, the brain and CNS, which is neuro, and the body's defense against external stimuli, which is the immunopiece. So that's why it's called psychoneuroimmunology. It assumes that all disease is multifactorial. It involves the three major body systems, your brain, CNS, your consciousness, the endocrine system, and the immune system. Now when you're talking about how these things are affected, you've got your catecholamines that are released from the central nervous system and from the adrenal gland. Your epinephrine is an adrenergic agent. It adds to or increases the effect of something. Epinephrine is also called adrenaline when you give it as a drug. It activates both the alpha-1 and the beta fibers. The alpha fibers and the beta fibers. Your beta-1 fibers increase myocardial contractility. Your beta-2 fibers increase hepatic gluconeogenesis, which is formation of glycogen from a non-carbohydrate source. And glycogen is sugar for the bodies to work with. You have glycogenolysis, which increases glucose release by the liver. It increases your serum cholesterol and your free fatty acids, as a result causing hyperglycemia. Your beta-1, along with increasing myocardial contractility, increases your heart rate, so that increases your cardiac output. It has both chronotropic and inotropic effects. Chronotropic, increasing the rate. Inotropic, increasing contractility. Or affecting contractility, but this increases it. You have an increase in the release of glucagon, which again raises your blood sugar. You have a decrease in the insulin production, so you end up with hyperglycemia, not necessarily glucose in the cell, but glucose circulating. And you have an increase in renin secretion. And renin, by the way, is spelled wrong. It should be R-E-N-I-N. And renin will cause vasoconstriction, and it will cause the conversion of angiotensin 1 to angiotensin 2, and it will cause smooth muscle relaxation, which occurs in your bronchi, your blood vessels, your GU tract, and your liver. And that smooth muscle relaxation in your bronchi means you can breathe in more oxygen, and you can have more blood circulating around. And there is a summary on page 212 for the actions of your catecholamines, and a table 12-7 on page 300 for their specific actions that you need to look at. Norepinephrine activates primarily your alpha fibers. Now, norepinephrine, if you give it exogenously, is called Levophed. That's the trade name is Levophed. And we used to call it Leave 'em Dead Levophed, because Levophed was last choice that you would use for supporting somebody's blood pressure. If nothing else worked, you'd try Levophed. Mainly because if it infiltrates, it can cause you to actually lose tissue, cause necrosis of the tissue around that. And so it's a very, very dangerous drug. But they are finding that it is very effective in patients who have sepsis. So norepinephrine is being used much more frequently. It increases your arousal and alertness. And the rest of what's listed here is what occurs normally in the body when norepinephrine is released. It will increase your arousal and alertness. It mainly regulates your blood pressure because it causes vasoconstriction of your smooth muscle. It decreases your GI secretion. It will dilate your pupils so you can see better. It dilates your skeletal muscle blood vessels so your skeletal muscles get more blood so you can run away faster. It dilates your airways so you can breathe in and get lots of good oxygen. And it increases your sweat gland action. Both norepinephrine and epinephrine are released from the sympathetic nervous system and by the adrenal medulla. Again, a table from another textbook shows some effects of your renin-angiotensin-aldosterone system, where you have a decrease in blood flow to the kidneys that causes the kidneys to release renin into the blood, that causes vasoconstriction, leads to vasoconstriction. Your renin reacts with angiotensin 1 to form angiotensinogen to form angiotensin 1, again causing vasoconstriction. And then you have angiotensin converting enzyme in the lungs converting angiotensin 1 to angiotensin 2, again more potent vasoconstriction, but also that stimulates the adrenal medulla angiotensin 2 to secrete aldosterone. Now aldosterone activates the sodium-potassium pump in the distal tubules of the nephrons, causing sodium and water to be reabsorbed. That increases blood volume, thereby increasing blood pressure. and it increases the amount of potassium that's secreted, so it causes potassium loss and hypokalemia. The endocrine system piece of this, your hypothalamus will secrete your CRH, or your corticotrophin releasing factor, and stimulates your pituitary and your adrenal glands secrete their hormones that are necessary. The posterior pituitary will release your antidiuretic hormone, and that, along with testosterone, will increase your blood pressure and your heart rate. ACTH from the posterior pituitary causes a release of cortisol. Prolactin from the anterior pituitary promotes lactation and breast development. And growth hormone, or somatotropin, pardon me, directly affects the immune system and the number of lymphocytes that are produced. It also affects metabolism of protein, lipids, and fats. The adrenal cortex will secrete cortisol and aldosterone. Oxytocin is also secreted from the from the hypothalamus, and with estrogen will decrease the stress response. And chronic stress will decrease the amount of growth hormone that is produced. Cortisol, it's really important that you understand this table. Cortisol mobilizes substances needed for cellular metabolism. It promotes glyconeogenesis in the liver, so this raises blood sugar. It decreases your eosinophils and your leukocytes, so thereby it decreases the immune response and delays healing, so it is considered an immunosuppressant. And it suppresses protein synthesis in lymphoid tissue and blocks cell-mediated immunity. It increases gastric acid secretion, so that can increase your risk for stress ulcers. It increases lipolysis in your extremities. So think of your chronic lung patients that have been on steroids long term, or your cancer patients, or your transplant patients who have been on steroids long term. They'll have very thin extremities. They'll have a big chest. They may have a buffalo hump or a fat pad on the top part of their back, their upper back, because they'll have lipogenesis of the face. They'll have a moon face. They'll have a decrease in bone formation, so they're prone for fractures, and they'll have a decreased production of interleukin 1 and 2, which again increases their risk for infection and for cancer and other problems. There's a table on page 213 that has even more of the effects of cortisol that you really need to know. Now, beta endorphins are secreted within the brain, and they appear to regulate your ACTH, or your adrenal corticotrophic hormone, and your corticotrophic releasing factor secretion from the anterior pituitary and the hypothalamus. They decrease the stress response. So this results in an increased feeling of excitement, well-being, and euphoria. So you feel a whole lot better when your endorphins are released. They feel that if you have a high level of endorphins, and your endorphins increase when you exercise, that you have a high level of endorphins, you feel really, really good, that you could fracture something and not realize it. They've had long-distance runners in the marathon, who have actually fractured their ankle and continued to run and didn't realize their ankle was broken until the race was over. Or patients who have a heart attack and don't realize it because they feel so good because of the endorphins. You can stimulate your endorphins by use of laughter and positive thought. And Norman Cousins had cancer and stimulated his laugh reflex by watching, I think, Laurel and Hardy and the Three Stooges and all the slapstick comedy that was done back in the 1920s and early 30s, and stimulated his endorphins so that he had no pain, and actually did affect his cancer, so it did decrease. But he's written several books about that if you want to read more about that. Now, your immune system is affected by your decreased growth hormone. Now, you use the same mediators to communicate with the immune system as you do with the nervous system. So The sympathetic branch of your autonomic nervous system secretes your corticotrophic releasing factor. This is your primary mediator between your altered immune response and altered immune functions, and your biologic response. It results in a decrease in your lymphocytes, your T cells, your natural killer cells, and your B cell function. It causes an increased risk for infection and cancer. Your circadian rhythm alterations can also decrease your immune system function. It will decreases melatonin production with a change in your circadian rhythm, and that decrease in melatonin will result in a decrease in your immune system function. That increase in melatonin produces an increase in immune system function. So think about when you're, it's toward the end of the semester and you've got 6 projects due and you're taking care of 3 patients clinically and you're sleeping maybe 4 hours before clinical and then maybe 5 hours the rest of the week. And someone sneezes on you and you get a cold or the flu or, heaven forbid, pneumonia. Think again about the summertime when you were taking no classes, maybe just working and dealing with your family, sleeping 6 to 7 hours a night, and you've been around somebody who had pneumonia or a cold or the flu and they coughed, sneezed, and hacked all over you, and you were just fine. It makes a difference. It's really important that you get an adequate amount of sleep. They've done research that shows that if you rotate shifts, that's not good. There'll be an increased number of accidents. There'll be an increased number of injuries. There'll be an increased number of illnesses. So rotating shifts is not a great idea. Staying on one shift, you need to get used to that. The stress response, again, is something that is initiated regardless of the stimulus. It's been around since caveman times. Think about, there's an area in your brain called the diencephalon, and think about a little caveman in there, so that every time somebody causes you a problem, or every time an idiot in front of you slams on their brakes while you're driving somewhere, or cuts you off, the stress response is activated. Your heart rate goes up, your blood pressures go up, your pupils dilate so the light now suddenly bothers you. Your sense of smell is a whole lot better, because these were initially set up to protect you from predators that were out in the field, a Tyrannosaurus rex or a pterodactyl or whatever. And so when you were under stress, you needed to be able to see better. Your hearing gets better. Your sense of smell is more acute. And people can identify where that stress is located in their body. Some people will feel it between their shoulder blades. They'll get really tight, or they'll get a headache, or they'll notice that their teeth are clenched or their hands are clenching. And all of those are responses to the stress response. If that stressor is not removed soon enough, or if that stressor continues to be repeated, the effects on the body will remain, and you'll end up with a patient who's hypertensive, who may have some kidney problems, some nutrition problems, some muscle aches or problems, and we need to treat it. You need to identify in your own body also how stress affects you, so you know how to deal with it and how to take care of it. This finishes the stress lecture, and I'll be talking to you later.